大家好，欢迎来到我的频道。我只是个推拿的，我是有权。今天有一份非常特别的消息要跟大家一起分享。我们很荣幸获得了美国推拿按摩大师老奶奶玛丽安娜的首肯。玛丽安娜她的对于推拿按摩有非常丰富的经验和深厚的知识，她将会带给我们一场非常好的视频的盛宴。为了让更多的朋友受益，我们不仅获得了她的授权，更特别为大家翻译了这份教学的影片。那希望大家能够更轻松的学习跟理解。在影片中，老奶奶玛丽安娜她将会分享她独特的推拿按摩的技巧。那这是一份非常珍贵的学习的机会，你绝对不会想要错过的。所以呢，希望各位大家在现在，我需要你们特别的支持，请记得要订阅我们的频道。我只是个推拿的，点击一下小铃铛。那在我们第一时间呢，可以获得最新的推拿教学按摩的内容，同时也不要忘记了把它分享出去。那么珍贵的教学影片，那再让我们更多的人能够一起受惠。谢谢大家。那千万不要忘了点击订阅，我们一同来迎接一个推拿按摩的奇妙之旅。马上喽，正片开始。
Hi, my name is Maria Natera, and today I'm going to be showing you some techniques for the rotator cuff and a little bit of anatomy and physiology. I like to start off right away. I've used some oil, my own special blend of essential oils, and I am going to do a little bit of effleurage and petrissage to warm up her muscles. And I like to go to the supraspinatus right here on the posterior part, the infraspinatus, and the teres minor. So from this position, you can access all the posterior muscles and also some of the anterior muscles. Now, the four rotator cuff muscles are the supraspinatus, infraspinatus, teres minor, and subscapularis. Out of all four muscles, three of them are in a scapular fossa, except for the teres minor. You also have your coracoid process right here, that's part of the scapula, her acromion process, which really shows nice on her, and her clavicle. Right here on the coracoid process, you have three attachments. You have the origin of the pec minor on ribs 3, 4, and 5, and it inserts at the coracoid process. And the origin of the biceps, the short head of the biceps, starts at the coracoid process and inserts at the radius, and the coracobrachialis origin right here, and it inserts at the medial shaft of the humerus. So while you're here, you can go ahead and massage this too, because a lot of people have, a lot of pain right here, especially if they have been playing tennis or baseball players, or reaching even to the back seat of their car when they hyperextend their arm. This area here may get injured and strained. And what I want you guys to understand is that the rotator cuff muscles sandwich the scapula in between. So you have three in the back and one in the front on the anterior part of the scapula, the other three on the posterior part of the scapula. Out of the four rotator cuff muscles, three of them are on the scapular fossa, and one of them is not, which is the teres minor is the only one that's not in the scapular fossa. So while you are here, you can go ahead and do a little friction and petrissage and effleurage. This also has the largest tendon attachment of the subscapularis, which is right here. So I'm going to put her arm in a high position to show you how you can access the subscapularis. So I'm going to reach on the back part of her arm and reach to the medial border of her scapula, pull it out laterally, and I'm going to palpate her subscapularis. And we drew it for you so you guys can really get a better view, because most people, it's hard for us to picture. You see pictures of muscles and you can't figure out which one it is. So right here is the subscapularis, and I can feel her scapula right underneath my hand. So you can go ahead and palpate very gently. You have your axillary artery right here, so you want to make sure that you don't feel a pulse, and if you feel a pulse, you stay off of it. So you can do some pressure, a little bit 1-inch strips. You can apply pressure with the palm of your hand and just massage it, and be very gentle, because this is really tender on people that are injured. And so you can see the muscle fibers going up and then it inserts right here at the lesser tubercle of the humerus. And you can work this 1-inch strips, your hands. You can do a little bit of friction. You can do some effleurage and petrissage right there to really make sure you get this. People with adhesive capsulitis, which means frozen shoulder, you can also help them because these muscles here are really tight. And if you loosen them up, you'll be able to get more mobility in their rotator cuff. Remember that this is a ball and socket joint, so it's got the greatest range of motion. However, it's also the easiest to dislocate, so you want to be careful and gentle. And here the clavicle is the easiest bone to break. Now I'm going to show you another way that you can access the subscapularis. You put the client's arm on your shoulder, and you reach underneath to grab the medial part of the scapula, and you pull out laterally, and you ask your client to move this arm to the opposite shoulder so it brings out the scapula, and I'm really in there. I am going in about 3 or 4 inches now. It's loosened up a little bit, so I can really go in there and massage medially, laterally, just gently though, however much pain tolerance your client can handle. You don't want to go above a 5 or a 6 on a scale from 1 to 10, because then you engage the nervous system and it starts releasing endorphins, and you don't want to do that. You want to create healthy patterns, not more pain patterns where the nervous system gets involved. So you can still see the subscapularis here that we drew underneath. I am getting the lateral border, and I am trying to reach in as far as I can, as far as she'll let me. By the time you've worked this for a couple of minutes, it's loosened up so I can really get in there. So this is another angle that you can get to the subscapularis, and the posterior supraspinatus, infraspinatus, and teres minor are on the posterior part. Okay, so now we've turned your client on the sideline position. You want to make sure that you're supporting the cervicals, that her back is nice and straight from C1 to C7, from T1 to T12, and the lumbar area. And you want to have the top leg supported and the bottom leg straight so that she doesn't put pressure on her hip. From here, you can really access all the 3 posterior rotator cuff muscles. From here, you can really see the scapula, and you can see the supraspinatus, the infraspinatus, and the teres minor. We have the spine of the scapula right here, and the supraspinatus is on this fossa. The infraspinatus is in this fossa, and the only one that's not in a fossa is the teres minor. You can really warm these muscles up. You even have access here to the levator scapula. You can do 1-inch strips. You can massage the upper trapezius right here, and you can really get to the supraspinatus right here on top. And as you can see, it goes from the medial part and underneath a acromion process. That's why it's not drawn all the way, because it goes underneath a acromion process and it inserts at the greater tubercle of the humerus. So it goes from here, it goes underneath, and it inserts right there. This originates here, and it goes also to the greater tubercle of the humerus. And the teres minor is from here, is the pink one, all the way to the greater tubercle. So this is the attachment. So when they tear an attachment, it will be right here, an insertion. So you can access all 3 muscles from this angle, and you can massage them. You can do with your knuckles. You can do some figure 8s. You can do some skin rolling from this angle. You can also access the serratus posterior superior, the rhomboids minor, rhomboids major, the erector spinae, and all I'm doing is just pushing a little bit right here so her scapula can really come out. And you can get to all the rotator cuff muscles, the 3 posterior ones. To access the subscapularis, you put her arm, she can hold it by the elbow. Make sure it's in a straight line, that it's not way over here or way over here, that it's also in a nice angle so you're not hyperextending her arm. And you're gonna reach, you don't wanna do 90-degree angles, you just wanna push lightly and go on the anterior part of the scapula, and that's another way that you can access the subscapularis, which is right here. And like I said, you can do 1-inch strips, palpating gently. You can do the money, like a money sign right here with your thumb and your fingers to really access even the teres minor and major right here and the subscapularis. So this is another angle that you can really get in there to palpate the subscapularis. So this is from the sideline position. So I am just working right here all along the scapula and accessing the 3 major muscles of the rotator cuff, and then you can access the anterior one, the subscapularis, right here. Okay, so now we've turned her into a prone position, and I've got, again, some of my special blend of oils with essential oils. And you can really see her scapula here. You can see the supraspinatus, the infraspinatus, and the teres minor, which are the 3 posterior rotator cuff muscles. And right here you can also access the upper trapezius and the levator scapula. If you just push up lightly, you can get to the origin of the levator scapula underneath. Because this muscle, a lot of times when they have pain up on top of the shoulder, it's either the supraspinatus or the levator scapula. So you can access that right here. You can do 1-inch strips all the way up to the occipital ridge, and that really relieves a lot of pain. You can get to the rhomboids right here and the erector spinae. The most superior muscle is the trapezius, which starts from T12 to here to here. So you're covering like 3 or 4 layers of muscles. Remember, muscles are in layers. So right here, you're accessing, again, the rotator cuff muscles, and they originate right here on the medial part of the scapula, and they all insert at the greater tubercle of the humerus. So you want to make sure and get the tendon attachments right here, because that's one of the places where it really hurts when people have problems with their shoulder. You also want to move their arm forward to reach. I'm going to show you another way to reach the subscapularis. So the arm is just hanging lightly off the table. You're going to pull on the medial part of the scapula just a little bit out, and you're going to curve your fingers very gently so where you can palpate real gentle on the anterior part of the scapula. You can really see, now that her muscles are warmed up, I can really get in there. I'm going in like 3 or 4 inches. If you can see, my fingers are really in there, and I can really go back and forth, medial, laterally, horizontally. I can also do the money sign right here, money, 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 to be able to get the teres minor, the teres major. Now, but just remember that the 4 rotator cuff muscles are the supraspinatus, infraspinatus, teres minor, subscapularis, and the scapula is sandwiched in between the 3 posterior and 1 anterior of the scapula. You always want to assist your client's arm when you bring it back. And if you are going to continue doing a little bit of effleurage and petrissage on the arm, remember that we always go centripetal towards the heart on all of the appendages, on all of the arms and legs. We go towards the heart. Pressure must be towards the heart because we have little valves that close to prevent backflow from going back. So you don't want to do damage and go against those valves. You want to be able to go forward and towards the heart, which is called centripetal. And when you are done, make sure that you reach closure with your client, that you do your nerve ending strokes. And we've really accessed the scapula right here. And I wanted to thank Angel, our beautiful model today. I hope you learned some new techniques to help you become the best therapist that you're meant to be. Look out for my next video, and please subscribe to my YouTube channel so you can keep updated. Thank you for hanging out with me today, and see you next time.